Hello, good evening or good afternoon, depending on where you are watching us this discussion today. And welcome to the Functional Solution discussion. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Chill.
Hi, everybody. Welcome.
And in today's discussion and class, we're going to talk about a very, very important topic. This is one of the 10 most disabling medical illnesses in the world, which is impacting about 1 out of 10 Americans adults. And so in today's discussion, we're going to talk about migraines. And this is a very important topic because migraine sufferers is a big challenge it's a big struggle for the patient. It's a big struggle and challenge for healthcare practitioners. And so we wanted to bring to you some of the interesting functional root cause approaches to migraines, the triggers, contributing factors, and as always, talk about some of the solutions, the integrative approach solutions, some supplements from an evidence-based use approach. So this is going to be very, very important for you and your patients. So Dr. Chill, we got I know that as healthcare practitioners, we all see patients with headaches or migraines, right? Those are unfortunately so common. Right.
It is. And it is a main thing that many patients will come into practitioners for. You know, it can be their main symptom that they come in for, or it could be a symptom that is coinciding with another few symptoms that they may have. So it's really important to understand all of the contributing factors and some of the functional medicine approaches. So I am glad that we're going to be discussing this. So instead of just like throwing a prescription medication at them, we can actually look at some of the underlying causes and actually address this for them.
Yes, absolutely. And you know, just from our experience working with patients with headaches or migraines, it's at least from what we have seen, there are so many patients out there who are on medication, sometimes multiple types of medications, and they're still struggling. And I know that the surveys in general with chronic patients showing, the Harris Poll group did a survey, they found that about 52%, a little bit over half of the chronic patients continue to struggle, and they are very frustrated with the current healthcare system. But especially when we come to headaches and migraines, is from the patients that we have worked with, you can see that the general approach in the standard of care is just to mask the symptom, right? It's rare that a practitioner will take the time and have the skills and understanding of what's actually driving migraines, and will do that, offer that comprehensive care and evaluation to their patients to really figuring out what's going on, what's the underlying causes that keep driving that chronic pain. And so this is really important for us to truly be able to identify what it is that's driving those migraines. How does the patient's diet, lifestyle, different factors that can contribute to migraines, and of course, have in your toolbox a few herbal or nutritional strategies that can significantly help them, right? We look at that as a more, not just natural approach, but an approach that has a lower side effects profile and could also contribute to a healthier function, right? So let's dive into it. This is a big topic. We'll try to include as much as we possibly can. And of course, we'll start by, I already started by mentioning that 1 out of 10 American adults struggle with migraines. So it is very, very common. Some periodically, some experience headaches and migraines periodically. Some are on more chronic basis. We've definitely seen patients that are in disability. We've seen a few patients who are in disability and they could not work. It was hard for them to function. And every time those migraines start, they have to be in a dark room for several days, right? And then it takes them several days to recover. So it's a really hard life to live, right? And we know that most people with migraines are in the range of 35 to 45 years old when they develop the migraines. We know that women are much more likely. Some surveys say 3 times more likely to experience migraines than men. And then, of course, the impact on loss of productivity, disability, medical expenses, right? I estimated in the US as about $23 billion every year, right? So this is a very big topic. There's a lot of patients out there. And unfortunately, it's very often not properly diagnosed, or many patients do not undergo appropriate evaluation and treatment. So this is why it's so important that you're here, advancing your functional medicine skills, learning about the root cause. So we'll get started, of course, as usual. We want to start by talking about the general triggers, known triggers that could contribute to or worsen migraines. And then from there, we'll dive deeper into the two of the major factors in functional medicine, so you will get some more understanding of that. And there's really two things that I want you to get from this hour class and discussion. One is have a really good understanding of what are the root causes, right? There are several root causes, but we'll cover today, in our short time together, we'll cover 2 out of several, 2 of the major ones. And we'll look at some really cool studies that have shown us that were done on animal studies and human studies, and will give us a lot of information about the different pathways that can cause those migraines. And then we'll give you some very practical strategies that you can already use tomorrow in your practice with your patients. That's how we like to keep it. Our programs are very applicable, very focused on the clinical application. And so that's what we're going to get into. And Dr. Chill, I feel like this is a good kind of transition to, once we already talked about some of the challenges and some of the some of the statistics and how common it is. I feel like this is a really good time to talk about what are the generalized common triggers for headache, for those migraines.
Yeah, it's really good to have a good understanding of the overview of like the triggers, right? And what can actually contribute to the migraines and why they may be having this. This is part of the picture. So let's go into some of these areas, right? Because migraines can be really complex and there are an array of causes and triggers. So I want to go through like a physiological breakdown. What happens is they appear to be initiated when an inflammatory cascade spreads, and this occurs within the central and peripheral nervous system. This can cause the blood vessels to dilate, and then different factors can trigger this cascade. So that's the overview of how migraines kind of function and how they occur, right? So now let's go into a picture of all of these different triggers that can impact this cascade. So this is an image from the biomedicine and the pharmacotherapy on some of the factors. And let's dive into some of these. Here we can see a range of different triggers, right? So on the left here, on the top left, we can see triggers such as food. And these can be from artificial sweeteners like sucralose, food coloring. Even gluten can be a trigger for some of your patients. And then some lifestyle factors that we want to consider for our patients that may be suffering from migraines are their sleep patterns. What types of stress do they have? Do they have a lot of emotional stress that is happening? And that can be a primary contributing factor or trigger for them. Then there may be some gene variations that they may have, and then some metabolic and hormone imbalances that we see in the pink there. And can be things like insulin imbalances, estrogen imbalances. And then you can look at all the way to the bottom, and this is the bottom center here. These are going to be the environmental factors, including heavy metal toxicity or other environmental toxicities that can trigger this for them. So when working with your patients who have migraines, or you're suspecting they may be migraines, all of these different triggers need to be considered for them.
So thank you for giving us that overview. I feel like this is really, really helpful, and kind of getting a look, a broad spectrum look, right, on all these different factors. And so this is one of those, and this is one of those factors, times where, of course, we're going to dive into the major factors that play a role. We're going to talk about 3 major factors that play a role. But as a side note, there's a reason why in our advanced and clinical functional medicine program, we have also included advanced topics like treating hormonal imbalance and identifying food allergies or sensitivities, right? Finding genomic variations with your patients, right? And proper testing, and how to address that nutritionally, because all of those different factors can essentially contribute to migraines. And so that's something that is important to know. Now, when we dive into the functional medicine root cause approaches, there are a few factors, but let's dive into the factor number 1 that kind of talks a little bit more about what is commonly happening with those patients. And I can share, and Dr. Chill can probably have some interesting experiences with patients with migraines, but I can share that working with patients with headaches and migraines, it kind of, for me at least, from my experience, kind of ranged between patients who had, mild headaches or periodically headaches, or headaches that are related to their period, or headaches that are related to when they're eating certain things, right? And those are typically much more responsive, right? And on the other hand of the spectrum, we had patients who are come to see us on several types of medication, right? And they were still struggling with ongoing headaches and migraines that are always there. And not only that they're always there, but they get at some points to this peak in which they're non-functional for several days, right? And the pain is so overwhelming that, depression sets in, anxiety sets in. It's just a very challenging experience. And throughout my career working with patients, a lot of those patients comes to see us and they pay out of pocket because they're looking for an alternative to what their provider prescribes to them, which is more and more medication. So they keep struggling, so they pay out of pocket because obviously they want to find a solution for those or anything that can help, right? And when you're in pain, and I can testify for myself, when I had ongoing joint pain, I tried everything out there, right? You name it, I was there trying to find some peace, right? So I'm trying to find even a little bit of relief, right? And so we had patients that tried everything. And this is where I wish I would have known what we're about to teach you. I wish I would have known that 15 or 20 years ago, right? These factors that they just don't teach you in healthcare programs, in nursing programs or medical programs or or chiropractic program, they just don't teach you these underlying root causes. So let's dive into the first one. So the first factor that we're going to talk about is neuroinflammation. And neuroinflammation, it's a big topic. And it is a key factor in the development of migraines with patients. And there are several studies, really interesting reports that showed that patients with migraines have a higher levels of pro-inflammatory cytokines, such as interleukin 6, C-reactive protein, tumor necrosis factor alpha, both during their migraine attacks and in between their migraine attacks, right? So let's take a look at an interesting picture from a study that I wanted to share with you. This is from the Journal of Biomedicine. It was published in 2022. And on the top, you can see the different stages and the pathways of migraine. And so there are different stages, right, from prominent, aura, headaches, and post-drome. And of course, with some patients, it could start like the few hours to a few days. The initial stage could start with irritability, depression, fatigue, muscle stiffness. These are all signs of inflammation, right? There's difficulty sleeping, right? Then it escalates into visual disturbances, temporary loss of sight, maybe numbness in different parts of the body. And then from there, it escalates to the red zone, which that's where the throbbing pain, sensitivity to light, noises, odors, nausea and vomiting is common, neck pain and stiffness. And then there's the post-headache phase, which is the fatigue, inability to concentrate, that exhaustion, right, where the patient trying to recover, right? And so when you look at the bottom, there's an interesting picture. It might be a little bit harder to see the picture in a circle, but that's where I want us to focus on. This is essentially what we're seeing here is the involvement of the hypothalamus and the thalamus, right? There's an involvement of the release of the corticotropin release hormone, right? And when the hypothalamus is triggered, it triggers the activation of the glial cells and the mast cells. And we know that mast cells, right, when mast cells are activated, they start degranulate and release histamine, right? And so the activation of mast cells release histamine, release multiple inflammatory mediators, such as also serotonin, proteases, and nitric oxide. Now, nitric oxide, as we know, of course, is involved in dilation of vasodilation of the blood vessels, which could cause headaches. And it also releases some arachidonic acid products and pro-inflammatory cytokines. So we have here an involvement again of those interleukin 1, tumor necrosis factor alpha, and interleukin 6. And as I mentioned, nitric oxide by itself is playing a significant role in migraine because it does cause the vasodilation of the blood vessels. Now, some studies have, and this is an important note, some studies have reported that when there's a nitric oxide involved secretion, it's more associated with that fast headache than that kind of slowly progressed headache that slowly increases, right? So that's maybe one way of kind of identifying what causing that headache, but there's going to be an inflammatory component to it. Now, that's what we refer to as neuroinflammation, right? That inflammation in the central nervous system. But it is also important to remember that there is that systemic inflammation that starts in the periphery or the internal organs can trigger that neuroinflammation. So for that, let's take a look at another interesting picture. This is from the Journal of Frontier in Aging Neuroscience. This was published in 2022. And I wanted to share this with you because you can very clearly here see how the peripheral inflammation induces neuroinflammation. And on the right side, there's different types of mechanisms, right? So if you have the patient has systemic inflammation, right, that peripheral inflammatory cytokines are produced as a response, right? Now, these cytokines flow in our bloodstream, right? And once they get into the blood-brain barrier, if there is leakage, right? If there is an issue with the transport proteins or the downregulation or damage to the tight junctions, right? Then what will happen is you're gonna have leakage of these cytokines, inflammatory cytokines, into the central nervous system. Now, once these cytokines are in the central nervous system, they trigger an inflammation by activating the glial cells, and they're causing what's referred to as glymphatic clearance dysfunction. So essentially, lymphatic clearance dysfunction, it's a process in which our brain waste clearance system is impaired. So now, instead of releasing and getting rid of that waste, that metabolic waste, it's just stuck in the brain, which leads to more immune activation and the activation of the hypothalamic pituitary adrenal axis. Now, as you're going in our advanced functional medicine training, you will learn more and more, of course, about the HPA axis. And you probably already know that the HPA axis, when that's activated, it's a very clear sign of stress. That could be an emotional, or in this case, physical stress, right? That is placed on our brain. And so, because the end results of the HPA axis activation is secretion of cortisol by our adrenals. So, and cortisol has an anti-inflammatory property. So it's our body's attempt to say, whoa, there's a lot of inflammation here in the brain. I need to get rid of it. So I'm going to activate the HPA axis to force the adrenals to push some anti-inflammatory compound called cortisol, right? Now, there's multiple things that can go wrong in that pathway. And of course, we're not going to talk about it today. We have a whole class on that specifically and how to support that. But know that could happen, right? And so there are really interesting animal studies that have shown that circulating inflammatory mediators, such as the pro-inflammatory interleukin-6, the cytokine interleukin-6, during systemic inflammation could also impair the function of the tight junction regulation in the brain endothelial cells. So essentially, if you have a patient that is, for whatever reason, they're constantly inflammatory, right? We know that some of the clear signs for that is joint pain, metabolic issues, they're feeling tired. There are multiple signs, right? Skin conditions. If they are inflammatory, then they have inflammatory cytokines that slowly damage the blood-brain barrier, right? And then slowly could cause damage to the tight junction, damage to the increase the permeability of the blood-brain barrier, and then from systemic inflammatory, it migrates and causes neuroinflammation. So the real question, so now that we covered that, we now understand the one of the major mechanisms. The real question we always want to ask ourselves is, what is causing that systemic inflammation, right? And as functional medicine detectives, right, there's a really cool saying in the Mission Impossible movies, right, which goes something like, your mission, if you should accept it, right, is to find what it is. And that's exactly what the functional medicine approach is providing you. It's that very valuable skills that patients pay for, right? For you to now look at their signs and symptoms, ask about the body systems, ask about their medical history, their lifestyle and diet, and identify what it is. Now, we have already made this a lot easier for you. In the training, you can download the clinical guide and the evaluation tool. The evaluation tool, we highly recommend to use it from your first month in the program. It's easy to fill up, and when you look at it, it will show you which category and root cause has the highest score and need the highest attention, right? I used it on myself as a case study. I used it on patients, family member, my father when he had some health concerns. So we invite you to download those tools and also work with Dr. Chill to help you build up your functional medicine muscle, right? So you can help a lot more patients. But that's exactly what we're doing. So Dr. Chill is going to take us now into one of the major factors that contribute to that neuroinflammation, to give you as a great example of how it's all connected in our body, right? So Dr. Chill, this is exciting because I know this is something that we have been talking about quite a bit.
Absolutely. So if you have been with us every week, you understand the importance and the role of the microbiome and the importance of maintaining a healthy gut, because an imbalanced gut can impact so many conditions. It's actually impacted every single condition that we have discussed in our podcast and these discussions with you. And migraines is another condition that the gut health can impact, and an imbalanced gut health can impact. And it's because of the inflammatory cascade that I was talking about earlier that can occur. This can actually occur and stem from your gut. So let me explain this a little bit further. The gut microbiome is involved in regulating our metabolism, our immune response, and there are several pathways and mechanisms, such as the gut-brain axis, which we discuss a lot in these discussions, and then the bacterial overgrowth and the byproducts of the bacterial overgrowth in the gut can also lead to systemic inflammatory markers. So let me show you a picture, and this might explain it a little bit further for you. So here's an image from the Journal of Headache and Pain, and we can see that the microbiome imbalances and alterations can also lead to migraines. In this interesting study, researchers evaluated serum samples and then fecal samples from 32 chronic migraine patients with NSAID overuse, headaches, and then 16 healthy individuals without headaches. Serum samples were collected, they were measured, and they measured the circulating levels of several different compounds. We can see the results of the study, and you could see it in this image here. It revealed that in compared to healthy individuals, the patients with chronic migraines and overuse of medications for headaches had an elevation of the following factors. They had elevated levels of bacterial polysaccharides. This is your LPS. These are markers of intestinal dysbiosis or an overgrowth of what's called a gram-negative bacteria, which causes intestinal permeability, or if you've been here, you understand that it's called leaky gut. These were also elevated. Other markers were also elevated in the high mobility group box 1, marked as HMGB1 that you see in the middle there. And this is a protein that plays a role in many cellular processes, including inflammation and DNA damage repair. And then you can see elevated inflammatory cytokine interleukin 6 or IL-6. Again, these are all inflammatory markers that can occur from dysbiosis and an imbalanced gut health or imbalanced gut microbiome. And we can see the results on the bottom left of the fecal samples showing that the patients with chronic migraine and chronic use of medications have a different amount of gut microbiome. This is why it's so important to learn the root cause, and if needed, test the gut microbiome, as we often do as functional medicine practitioner. And study is just showing that the presence of dysbiosis, this goes towards the inflammatory state. And then there is a connection between altered gut microbiome and inflammatory serum parameters that we're seeing right now in these studies, and then migraine and food triggers that we're seeing in this image here. So this is a really, really important factor to consider when you are working with patients who have chronic migraines. It's not just about alleviating their symptoms, right? It's about finding the root cause, addressing it, so you can really reduce the severity, the length, and the amount of migraines that they have. And the gut microbiome is going to be a major area that you want to investigate for them.
Perfect. And I'm glad that we brought up the gut. It's so important to support the health of the gut. And of course, there are multiple ways on how to do that. Eating sufficient amount of fiber, eating a cleaner, more organic food is healthier, which is kind of reminds me that we were and a little interesting experience where we, over Thanksgiving just last week, we went to Reno, where my wife's family is from, and we rented an Airbnb, and it was a really pleasant surprise to see. We were driving in the dark because we kind of got there, and it was really interesting to see. Every time we come back to that Airbnb, it was a building that was surrounded with a fence. It had different animals all around it, so it was really interesting, like a mini farm, and a little bit out of the city. But it was really interesting, that experience of talking to the owner of that place, and they had chickens running around, and they had horses and all sorts of animals, and talking about the owner on how, they mostly just eat from what they grow, right? Which is really, really cool. So they eat like organic eggs, which they pick from the chickens. And, it was really interesting to see how we used to be a lot more connected to our food, right? In a way that obviously had health benefits to our gut. But it was just a interesting experience. And they had emus, which I've yet to see in as a pet, which is really interesting. They had 2 pets, emus. I've never seen a pet emu before, but it was really, really cool experience. So,
were you able to pet them?
I was a little hesitant to pet them. But one of the owners, when he showed me the eggs and how the whole thing, and the emus will come under his armpit, put his head under the armpit, and kind of rub his head, almost like a little dog. It was really
that's awesome.
It was really interesting, and apparently they flew them as when they were very young from Australia. Apparently that's where they're coming from. So it was really cool, and we also have the traces of a little dinosaur. So if you move their feathers, they're around the chest area. They have this little tiny little arm, kind of like a little mini T-Rex, a remnants of their
so cool.
T-Rex ancestors. Yeah, so it was really cool. I just wanted to mention that because when we talk about gut, healthy food is always important. We do teach a lot about, if your patient wants to take supplements, like there are specific supplements for dysbiosis. Beyond antibiotics, there's specific herbal treatment protocols that you'll learn in the advanced program. There are specific nutritional supplements. They can take it in powder or pill form. That's easier, right? But diet is, for all of us, is really important, right? Eating organic and clean, and then our bacteria, healthy bacteria really likes fiber, vegetables, right? Fruits are really beneficial. So I'm glad that you covered that. And now we also understand the connection between how changes occurs in our gut, and it can cause systemic inflammation and then neuroinflammation, right? So that was a really interesting thing to mention. So now we're going to jump into the third factor, and this is a very common exposure. Unfortunately, we are all exposed to it 24/7. Some of us exposed to this factor more than others, and some of us are being impacted by it more than others. And this is the environmental chemicals. This is such a big topic that we have specific class on identifying the signs and symptoms of each group and the proper detoxification and treatment protocols. But there is a a strong association in multiple studies between exposure to these chemicals such as pesticides, heavy metals, mold toxicity, particulate matter, and flame retardants. Those are just a few of the very common ones, and an increased risk of experiencing migraines. And even in moderate levels of these chemicals, they can trigger headaches in some susceptible individuals. Just to give you an example, heavy metals such as lead is very common in houses that were built before 1980 because it was heavily used in paint and other building material, and over time it just leaks out and released into the air. That's where we're breathing it. Now, there are multiple groups that we are all exposed to, unfortunately, on an ongoing basis. And you will learn about all these different chemicals and how they impact our health, how to eliminate and test for them in our Advancing Clinical Functional Medicine program. But for now, I wanted us to talk about one particular group, which is called particulate matter. And I'm going to share with you a picture from the United States Environmental Protection Agency so you can kind of see the difference between particulate matters. And what we can see here is just as a side-by-side, the different particulate matters to give you an idea of what it is that we're going to talk about. And we're going to go all the way from 90 microns, which is like a fine grain of sand, all the way down to 50 to 70 microns, which is the width of a human hair. And then we can go down even more to particulate matter 10, which is dust, pollen, mold, right? And then we can go even lower into the smaller particles, which could be metals, different organic compounds. And these are higher concern. The most concerning are the PM10 and PM2.5. PM2.5 is very fine particles, which we can all breathe in all the time. And we're going to be exposed to it, obviously, with fuel combustion. So as we're driving or walking outside, we're all breathing it in. Dust particles that could have metals. If you're broiling or frying food, there's more particulate matter that is released up into the air. You're burning candles or oil or fireplace, you're going to have more particulate matters. And of course, if you got patients that are working in construction sites, then they're going to be constantly exposed to that in a higher amounts than we're all going to be if we're working indoor in an office, for example, right? But we're all exposed to it. So now that we understand the different sizes, we're mostly going to focus on PM2.5. There's a lot of interesting studies on that. So let's take a look at another study. It was published in the Journal of Environmental Science and Pollution Research in 2020. And the reason I wanted to share with you this study is because air pollution is an important cause of these non-communicable diseases and neuroinflammatory conditions. There's essentially, the study talks about how PM particle matters that are 2.5 and smaller than that can actually cross the alveolar capillary barrier, right? And they can travel to other organs in our body, and including our brain, right? That's where the connection to those neurological conditions occur. And particle matter might translocate to the brain through the olfactory nerve, or translocate from the systemic circulation and produce inflammation. So again, if we're breathing it in, let's say and it's not an if, we're all breathing it in. We're breathing it in into our lungs. It goes into systemic circulation. If your patient has an issue with the blood-brain barrier, right, that we talked about, maybe because they already have other chronic conditions, they have systemic inflammation, they got gut dysbiosis that constantly trigger that inflammation, then they might be more susceptible, right? They might have what we call leaky brain, and those particles can go much more. But this particular study has also showed us that it doesn't have to cross through the blood-brain barrier. It can actually travel through the olfactory nerve, right? And so once it does, you have infiltration of monocytes, you have activation of microglia, you have the production of reactive oxygen species. So in other words, these particles lead to an inflammatory response in our brain. And there are particular studies that found that there is more inflammation when there's more exposure to particular matter in the cerebral spinal fluid. And essentially, those reactive oxygen species, those are free radicals that disrupt the healthy functions of our neurons. Now, it can cause neuroinflammation. It's associated with migraines. But over time, right, and we're not going to get into that, but over time, it could cause damage, long-term damage, that is also associated with cognitive dysfunction, Alzheimer's, dementia, Parkinson, all of those other conditions. Now, as I mentioned, this is something that we're all exposed to, and we'll talk in a minute how we can reduce exposure, right, to help ourselves, help our patients. Now, just to give you another example, this is really interesting study that I found that was published in the Journal of Stroke, right? And this is sort of like to think about what is the long term of a patient that has a migraine or neuroinflammation, and they're constantly they're jumping from one practitioner to the other, and they just get another pill, but they never ever identify the root causes, right? They never identify that this patient might be overexposed to a certain, chemical. There is a research that was published in the Journal of Stroke that showed that exposure to particle matter 2.5 is associated with a smaller total cerebral brain volume, which indicates that there's a potential link between the amount of air pollution that we are exposed to and the size of our brain, right? So this is, by the way, reduced brain size is also a marker of accelerated brain aging, right? So in essence, what this study that we're going to post it again here so you can see, and if you want to read more about it, you can do so. But essentially, the study of this Journal of Stroke showed that higher exposure to particle matter 2.5 is linked to a lower total brain volume. So let's talk about what can we do about it. And I already gave you some tips when we talked about exposure, where it's coming from, right? If you got a patient that works in construction, they very likely are going to have much higher exposure. If you have a patient that is working in a nail salon, right, and using a lot of different chemicals, if they're working in cleaning, if they're working as mechanics, right? If they're working in a factory, right? They might have higher rates of exposure, right? But we are also exposed to it because even if you're sitting in home or in an office, you're still exposed to these PM 2.5. So what do we do about it? So one of the effective ways to reduce exposure is to use a high efficiency particular air filter. This is known as a HEPA filter, and it is the most helpful thing we have right now to remove fine particles and improve the quality of our air. And the United States Environmental Protection Agency reports that HEPA filter can remove close to 99% of the dust, pollen, mold, bacteria, and other airborne particles. So this is something that is really important to know, and I'm going to give you some really cool examples of some types of HEPA filter that I've been using. But more specifically, there is another really cool study, and if you want to read a study article about it, there was a study that was published in the Journal of Exposure Science and Environmental Epidemiology, reported that air filtration units that they tested decreased the concentration of indoor PM 2.5 by 52 to 60% in comparison to no filtration. So even when we talk about very, very small particles, this particular study of showing that you can get a significant reduction in the pollution, especially the really fine particles, the 2.5 particulate matter, by using air filtration. Now, two recommendations that are coming from this study and from other reports is that, one, if you open up the window, it's very likely that you're going to get more of those particles in, right? Especially if you live inside the city. The second thing is, the more you run these air filters, the better. Typically in my house, I'll run them 24/7, right? They're really simple. They don't consume too much electricity. And I wanted to give you a couple of examples so you have something you can use for yourself, your family, or even recommend to your patients. So so we're going to post both of them. One of them is a larger one. The other one is a smaller one. Both are quite affordable and very simple. The one you see on the right side, that's the Ethereal APH 260. It's an air purifier for home use and office use. It's got 3 stages filtration. It's called the True HEPA filter. Amazon sells it for about $92. I've actually have 3 of those, one in my living room, one in the office, and then one in my bedroom. And they run it all the time because remember, there's these particles we're exposed to all the time. The one on the left is a smaller one. So if you want a smaller model that is much more affordable, this is the Slivu air purifier for smaller rooms. This is great up to about 220 square feet rooms. It's small. You can adjust the different speeds of the fan, and it's about $39. So it's quite affordable to have that. This is, by the way, also great. I found it to be really great with patients that have allergies because it reduces the amount of pollen significantly in the room. So these are 2 recommendations. Hopefully it can help your patients or your family. And one of the things that I wanted to mention is the general recommendation is to replace the filter every 6 months. We have pets in our house, so every time I open the filter box every month or 2. And if you have pets, you're gonna see a lot more of this debris and some pet hair. So I would recommend just every month or 2, just vacuum it, and then just put it back. It takes like half a minute. It's really, really simple. And then every 6 months replace it. Also, these particle matters they tend to accumulate on carpets or different surfaces. So we would recommend patients to vacuum every week and kind of clean their different surfaces in their car, office. Make sure that every week they just sweep the dust, right, with a wet with a wet fabric or a towel or something like that, right? So this is another factor, and that picture very clearly show how we can all breathe it. It goes into the brain. It causes neuroinflammation. Could contribute to migraines. So now that we have talked about these, we wanted to share with you a couple of supplements to kind of go into what would be the approach with a patient, that what would be two of the strategies you can use with your patient to help reduce those migraines. So of course, a general recommendation, right, Dr. Chill, is we always say if there's inflammation or neuroinflammation, you got to reduce that inflammation, right? You got to use, we have different protocols that we use, anti-inflammatory protocols, right, that are very general, right? And I know that that's typically where we start, right?
Absolutely. So the point is, now we understand the contributing factors and some of the functional medicine approaches, right, to the underlying factors. So while you are investigating all of these factors, right, like the neuroinflammation, the gut health, the particulate matter, while you are investigating that and working on that and balancing that out with them, we wanted to provide a couple of supplements that you can utilize for them while you are balancing out their other body systems. And this is all meant to help with reducing the severity and frequency of the migraine. One of the supplements that you can look into, it's actually an herb. It's called butterbur root. And some of the studies report that there is a 50 to 68% reduction in migraine frequency with butterbur root. And there's a specific extract in it. And the plant, it's because it contains this liver toxic pyrrolizidine alkaloid, and it's when you get the butterbur, what you want to do is get the alkaloid free extract preparations for safety. That's something to keep in mind when you're looking at your supplements. And according to the NIH, which is the National Institute of Health, there was a 2022 review of a randomized double-blinded placebo-controlled trial. What they found was that butterbur at 150 milligrams, they use what's called Petadolex. This is a brand name supplement of butterbur per day. This significantly reduced the migraine frequencies. And as I mentioned, it was 50 to 68% reduction in migraine frequency. This is huge for your patients. Any type of reduction, either in frequency or severity, and this actually helped with the frequency and severity, will be very helpful for them. And the dosage consideration for this is 150 milligrams daily. And what you want to do is have them do this with meals for 4 to 6 months. Then you can actually gradually reduce the milligrams or the dosage to the lowest effective dose to maintain migraine remission. And then another supplement that you want to look into is feverfew. And this is an herb that's native to southeastern Europe. And researchers are showing that feverfew, there is a specific constituent in it called parthenolide. And this constituent, it has anti-inflammatory effects, and it's was shown to relieve smooth muscle spasms, and then it could be potentially helpful against migraines. The studies that have used feverfew, this is typically in combination with other natural ingredients. It has shown to be reducing the frequency and severity of migraines. And then according to a 3-month study, and this was included in Mount Sinai, This involved 49 participants, and a combination of feverfew with magnesium and B12 or B2 resulted in a 50% reduction in migraine occurrences. And the dosage for this was 50 to 100 milligrams daily. And this was the standardized to contain the standardized constituent. It should contain about 0.2 to 0.35% of the parthenolides that I was mentioning earlier. So when you're looking at the supplement with feverfew for your patients, you want to ensure that it has at least 0.2 to 0.35% of the parthenolides in it. And if you want to read more about that, this is the study that you can go to, and it is from Mount Sinai Health. And so what I typically do is I will either give my patients Butterbur or feverfew or the mix of the two, along with, if you're going to do feverfew, you want to ensure that you're doing things like magnesium and B2 with it. And that is going to potentiate the effects, the anti-inflammatory effects for your patients, to really alleviate their migraines for them, both the frequency and the severity. Sometimes I'll start with feverfew, and then other times I will switch from feverfew to Butterbur just to help with alleviating their symptoms. Because when they come into your practice with these chronic migraines, you do want to alleviate those migraine symptoms for them as soon as possible while you are investigating and addressing some of the root causes that are occurring that we mentioned earlier.
Yes, those are great recommendations, and I think that it feels like we cover a lot today, and where we typically, from my experience, where we typically want to get started with a patient is reduce inflammation, right? So we can use like an anti-inflammatory protocol, because we know that if a patient comes to see us with a migraine, it's very likely that they have neuroinflammation, because that's one of the things that typically involved in those types of chronic pain. And so have a good protocol for reducing inflammation. And then from there, pick one or two or both of those supplements, because we also want to make sure that we address that pain, that ongoing pain, and help to reduce the frequency of that pain. And then from there, have a conversation with the patient about, if they're interested in learning more or finding what's driving those migraines, and what are the root causes of those migraines, right? Because the idea behind it is, if we can help them to identify what's the root causes that keeps driving those migraines, we can offer a more long-term solution, right, to that problem, instead of just trying to keep on masking those symptoms, right? And that's really the biggest difference between, in a conversation that I had with a medical practitioner just yesterday, and they asked me, what's the difference between integrative medicine and functional medicine? And I said, well, they're both helpful for patient, right? In integrative medicine, you do stress reduction and some nutrition, some herbal medicine, right? And we also have the integrative approach in our program, in our advanced program, because we teach a lot of nutritional. We actually certify you as a functional and nutritional medicine practitioner, right? So we have a lot of treatment protocols. We have a lot of integrative medicine. But the biggest difference between those two approaches is that in a functional medicine approach, we don't try to manage just to manage the condition, right? We go beyond management of the condition. We ask ourselves, what's causing that problem? What's causing those symptoms? What's causing those conditions? Because we want to have a much more longer term effect on this patient. We want to have a massive impact on this patient, because we got to remember, if we don't address the root cause and we just replace a drug with a herb, right? What essentially will happen is the patient might feel better, right? maybe their labs will look a little bit better. But if we don't address the root cause, we know that some of these same mechanisms we talked about today, the exposure to the environmental factors, the gut dysbiosis that Dr. Chill talked about, if we're not addressing those issues, then, and we're just symptomatically reducing the pain, and it doesn't matter if we do it with a herb or a drug or whatever it is, right? If we don't address the root cause, that patient could develop a more serious complications or more serious conditions. An example that I showed you guys today was that study that showed that ongoing exposure to some of these environmental chemicals like particle matter 2.5 is associated with reduction of the brain volume. And there's also studies that show that it's associated long-term with dementia, cognitive decline, Alzheimer's, right? So we don't want to just slap a Band-Aid on it, right? And send the patient home. We want to create a commitment, create an engagement to work with them for the next 3 months, 6 months, right? With whatever capacity you decide with your patient, but help them, offer them, if needed, the functional lab testing, right? To figure out what's happening, right? Offer them the treatment protocols, use the evaluation tool. Dr. Chill is a great resource. You can, in our program, you can reach out to him, schedule a coaching call, start working with those tools, even from your first month in the program, right? It's available to you, and we want you to start helping patients. And Dr. Chill, you had amazing experience so far from what you were sharing and other community members were sharing with doing those coaching calls and using those tools.
Right. It's they get to understand how to utilize those tools, and then how to utilize the information that is being presented in this program, and then applying it to their patients and their case studies, right? How are we taking this complex information, prioritizing it, utilizing labs, and then putting it in the clinical setting so they can improve their patient's health? And then how do you monitor that, right? What are some future considerations? We go through that step by step, and we really individualize it by the practitioner's cases. And the practitioners are loving it because they get to collaborate with myself on figuring out all of this information for their patients.
Yes, absolutely. And that allows them to offer, what I liked about it, when I was struggling with chronic patients and I first started a little bit over 20 years ago, is that, they would come to me and I would try to do some nutritional medicine, some integrative approaches. And, now that we have this functional medicine approach, we have the root cause approach, we can offer a much more comprehensive service because we can tell them and try to find out what's causing it, right? So once you address those root causes, the transformation is much bigger, right? It's much bigger transformation for a patient to, instead of, sealing the leaky roof and, instead of putting a bucket under the leaky roof where it's leaking in different places, right? We're addressing the roof. We're either rebuilding the roof. So now, we're addressing the root cause of this problem. So it is, patients understand when we explain to them, this is a bigger investment of time, money, effort than just going to a primary care practitioner, 5 to 10 minutes visit. Maybe you pay a $50 copay, or maybe you have a deductible. I don't know. Some patients have a $5,000 deductible, so they pay either way. They get charged either way, the full amount. But it's a little bit more of an investment up front. But the end goal is, a lifelong of healthier function, right? And that's how we used to explain that to patients. And a lot of patients would say, "What about insurance? Are you taking insurance for functional medicine?" I would say, well, my goal is to help you, right? My goal here is to do 100% everything that I can to help you to find what have made you sick, what's keeping you sick, what's contributing to those migraines, and together we can work towards figuring that out, right? We got clinical tools, we got evaluation tool, we got We got labs. Patients love labs. Patients love seeing the data. Like we would sometimes show it to patients, and it would be like, "Oh, I want this lab. I want this lab. I want this lab." And I would tell, I would sometimes have to I would sometimes have to hold them back and say, "Wait a second, like we're just in our evaluation stage. I just wanted to show you some of the tools we use." But a lot of patients would look at that and say, "Wow, like I have no idea that I can actually look at like what's happening in my gut or test if I'm accumulating some of those chemicals in my body," right? So patients love those tools. They understand that this is a different investment in terms of time, effort, and money, but it's an investment in their health, right? So we're not trying to mask things. We're trying to actually optimize their health, which is something that it's a true blessing. That's what I always believed. And I know that we had great success stories. You have great success stories from your brick and mortar and virtual practice, and that's really what we're passionate about. We got you in our program. We got 18 other specialists and experts that have, some of them over 25 or 30 years experience as functional medicine physicians. Some of them wrote the textbooks in functional medicine, like Dr. Liz Lipsky, who teaches in our program. So that's what we're proud of. And as you're listening to us today and you're with us today, reach out to Dr. Chill, schedule a coaching call, get your functional medicine muscle built up so you can help as many people as you want. Don't wait until you're certified. You don't need to wait. We don't mandate to wait until you're certified in our program. You can go through our Quick Start program. It's a two-week program. Learn the fundamentals and start using it to help your patients as you advance in your skills and eventually getting certified. We want all of you to get certified, get that certificate on the wall, share it with your patients, right? That you're offering this incredible service, very valuable. So as usual, I want to thank all of you for being here. And I want to thank Dr. Chill for helping us putting this together and sharing his experience. I also want to thank our media team, and Jacob, that has been putting this and allowing us to be with you wherever you are. And as usual, I appreciate all of you for everything that you're doing for your community, for being there every day, helping them out, guiding them towards better health, and investing in yourself so you can get better and better results for your patients. As usual, if you want to learn more about migraines, neurodegenerative diseases, neuroinflammation, log into the Advancing Clinical Functional Medicine platform. Continue your building up your skills. Reach out to us, and we're always here to help. So we appreciate you. Take care in the meantime, and have a good evening, everybody.